Welcome back to Great Day Houston. Today there are more survivors than ever when it comes to breast cancer because of a thing called the mammogram. It's still the best way to detect whether cancer is lurking. Joining me now is Dr. Ashley Rourke. She's a radiologist here at Smith Clinic under Harris Health. All right, I have so many friends who've made every reason why they don't have time to get in and get their mammogram, but it still is the best way for us to detect what's going on, right?
That is correct. It is. It's currently the best tool that we have to detect breast cancer in its earliest stages. And what that means is when we detect breast cancer in its earliest stage, the treatments are more successful and the overall prognosis for the patient is the best.
All right, complaint from a friend number one. She just got her new breast implants and she's like, oh, I can't get a mammogram if I have breast implants, can I? True or false?
That is false. So breast implants should never prevent a woman from getting a mammogram. It can make some of the breast tissue more difficult to see, which is why we do a couple of extra pictures to make sure that we really get a good look at the breast tissue, but it should not prevent you from getting a mammogram.
Okay, the other one is I do my own self-exams. I think I could be able to find something I'm in tune with my body.
Yes. That it is a good idea to stay in tune with your body, and we do want you to be aware. However, to detect breast cancer in its earliest stages, the mammogram is really needed.
Okay.
For that purpose.
There's also a concern out there about being exposed to radiation.
Yes. The amount of radiation you receive with a mammogram, with our latest technology, it's very, very low. So the way that I think of it is everything in medicine is a risk-benefit ratio, right? The risk of radiation to your body is very, very low compared to the benefit of potentially detecting a breast cancer.
And then how many times have you heard people say, it's gonna hurt, it's gonna hurt?
Yes, yes. So the mammogram machine unfortunately does require that compression, but the exam takes only a few minutes. The compression is very short and then it's released. So we can't get around that. It helps take a better image, helps us see the tissue better, but it's a very short.
Yeah, and I've had mammograms done before and I've had no pain at all. Excellent. Okay, another myth that we have is it doesn't run in my family, so I'm not concerned.
Yes, the important thing to remember is actually the majority of women that are diagnosed with breast cancer have no family history. So that's a very common thing I hear from patients, and that should not prevent you from coming in to get a mammogram.
Generally, at what age do you start to get a mammogram?
The American College of Radiology recommends starting annual mammography at age 40. Although there are differing guidelines out there, there is agreement that we save the most lives when we start screening at age 40.
What if you do have that family history?
If you do have that family history, you should discuss that with your doctor. There are women that have a genetic predisposition to developing breast cancer, and what that means is breast cancer runs in their family. Yeah. If you do have that history, it's important to talk to your doctor, and if you need screening sooner at an earlier age or need additional exams, they can schedule that for you.
Yeah, and as always, we should know our body best, and sometimes, you know, you hear people say something was just in my mind. So if you have any suspicions at all, you can always check and see.
Absolutely. I always say patients know their body best. So if you detect anything new or different, you can often be the first person to detect subtle changes in your body. So if you notice anything new or different, you should see your doctor right away, and they'll order further testing as needed.
Okay, I have to admit, last year I missed my mammogram, and I kept thinking I was going to get it done sometime in October. I think in our head we think Breast Cancer Awareness Month, October is not the only month you can get your mammogram, but I blinked and all of a sudden a year passed. So I have to admit I'm a little nervous right now, yes. But what we're going to do is I'm going to get my mammogram, and when we come back, you're going to actually read it for us. Now, normally when patients come in, you don't read it right there with the patient, but just for the sake of showing you what it is that she's looking for, yes. and the differences and changes that she's looking for, you're going to tell us what it is that you do that can lead you to a suspicion, which will later lead to other treatment if you see something there.
Exactly.
All right. Yes. Thank you very much. Everybody out. I'm getting my mammogram. All right, the mammogram is all done, just took a few minutes, and I have to tell you there was no pain at all. But now is the really important part. We're going to join up with Dr. Rourke and see if she sees anything of any concern. I'm now in the room with Dr. Rourke, and she's going to basically read my results in just a minute. I want to stress that for the average patient coming through, they don't sit down with the radiologist. However, timeliness is important with you all, where some places can take up to a few weeks to get results. You all do that in a lot shorter period of time.
Absolutely. So our goal is to read our screening mammograms within 24 to 48 hours. At that point, a letter is sent out in the mail to the patient, so they get their results very quickly.
All right. What is it that you're looking for? Because most of us will look at this and go, ah, you know, and we see things on here, but what is it that you're looking for in particular?
So when we look at the breast, in this image in particular, these white structures are breast implants, and this white wispy tissue in front of the implant is normal breast tissue. So what we're looking for is any asymmetry between the breast. We're looking for masses, calcium deposits or calcifications, and those are the main things.
Yeah, and of course when you look at this, you'll see, like we say, self-breast exam is important. You always encourage that because women have found things by doing their own examination. However, if something was like off into here, it would be impossible almost for you to feel that, right?
Exactly. Abnormalities that are deeper in the breast can be harder to feel until they become a certain size, and we don't want that, right? We want to detect it early, and we can see that on the mammogram in most cases.
Why is it important for y'all to also have the images from previous mammograms? How does that help you?
Right, so what we do is look all the way back as far as we can to comparison mammograms, and that allows us to detect subtle changes in the breast tissue over time. So having your comparisons is very important. We take a thorough breast history. We want to know about any surgeries, biopsies. That way when we see areas on the mammogram, that will make sense if we have that history.
Yeah, all right, so you're looking at this with a breast implant. Somebody without a breast implant, then you'd be looking at what, just the...
Exactly. It would look just like this, just without the white implant behind the tissue.
Okay, and then also, you don't only take the mammogram with just the breast tissue. I noticed in there that she was also getting up into kind of like where my muscle connected with the breast tissue there, and so making sure that there's not something lurking in those areas.
Exactly. On the other view that we do, we go all the way up under the underarm area to get all of the breast tissue that extends up there as well. All
right, Dr. Work, we're going to take a break. And when we come back, we're going to take a look at exactly what my mammogram tells you. And the other thing, if somebody were to get the news that they have cancer, what's great about this program here at Smith Clinic under Harris Health is that that's when the real work begins, the real journey begins, and they hold your hand through the entire process. We'll meet up with a woman who is thankful for the people here who really became her extended family.